Dr. Amanda with StraightSmile Solutions, and today we're going to be talking about Quad Helix. Hey, what's old is new again, and I never stopped using these. I think they're great appliances. I think people are starting to find their use again. So I just wanted to give a quick shout out and thank you to Specialty Appliances for sending me the demo of this model so that I could teach you guys how to design one and how to deliver it in a patient. And we'll talk a little bit about indications for use. But basically, this is a great expansion appliance if you're looking for something that you don't have to regularly activate. Um, Everything is built really into the design of the appliance and it just kind of does its job. Now, you can't leave this thing in forever. You're talking probably 3 months or so, plus or minus max. So you need to give this to a pretty compliant patient. Also, it does leave a pretty gnarly imprint on the tongue. It's not the most popular appliance because it can be, you definitely get some discomfort on the tongue initially. You can get some cuts. So you want to make sure you pick the right patient and brief them accordingly. But basically, in a nutshell, you're going to go ahead and order a Quad Helix appliance, and you can go ahead and deliver these in adults too. So that's totally fine to deliver them in adults that have like a crossbite or a narrow upper arch. I'll take these any day over bending wires and doing cross elastics. So, and you can have buckle hooks soldered on the side of them so that you can attach braces to them. You can also use this as pre-orthodontic therapy and deliver this in kids or even adults before you do aligners. If you want to get some great expansion, have the aligners go quicker. There's also a mandibular version of this appliance. I think we call it a W arch, if I remember correctly. And similar but different, you're going to get mostly tipping with these appliances, not necessarily bodily movement. But for any case, they're really great. So basically what I do before I design and deliver one is I go ahead and I use my bully gauge, which is right here, and I take measurements at the point where the wire exits the solder joint, here and here, okay? And then like this, I'm kind of doing this without looking, but in any case, you can see what I'm doing. Take the measurement. In any case, this was, I think it was about 34 millimeters. You also want to take the measurement at the tip of the points here. I think this one was about 21 millimeters. You're looking for, I would say, about 4 millimeters of expansion built into the appliance, 4 or 5 millimeters. Honestly, the easiest way that I just expand it, and sometimes they come pre-expanded from the labs that you need to see. I mean, obviously, if it's coming on and off the model passively, it's not expanded. It's not going to do anything. So you have to build the expansion into it. They may pre-expand it for you. So figure out what you're getting. But it's pretty simple. This is actually cemented on here right now, and it's permanent cement, so I can't pull it off. But if I was able to pull it off, I'd grab it and I'd hold the bands each in one finger and I would pull gently until I got that 4 millimeters of expansion. Some people will use a 3-prong plier to do it, but for me, the pull technique works better. Evenly pulling and getting that 4 millimeters of expansion both here and here. Although, if you want more expansion in the anterior region, you can pull up here a little bit more. And if you want more in the posterior region, then you're going to pull a little bit more down here. So there's not an exact science. And the beauty is you're going to see these patients every 3 to 4 weeks anyway. So you want a little bit more expansion than you're looking for, ideally. Obviously, other things that you're going to be doing is checking the buccal roots as you go along, checking for mobility, sensitivity, things like that. Bite opening up, a couple things you'll be looking for. For the most part, it's a pretty easy appliance once they get used to it. The first week, like I said, is rough, but that's pretty much it. That's what a Quad Helix is. So a great universal expansion appliance, and it's pretty much idiot proof. You really can't screw this up as long as you don't leave it in too long. So definitely 3 to 4 weeks is max. I mean, if you had a super constricted palate, maybe you could take it out and reactivate it. You can even reactivate it in the mouth, but I really think that 4 millimeters is really quite enough. If you're needing so much more, you probably don't want tipping anyways. You probably, in a growing child, want to consider sutural, actual skeletal expansion. And in an adult, you want to be considering surgery. So that's pretty much it. That's how you use a Quad Helix. Hopefully that helps. And thanks again to Specialty Appliances for the demo.